The Trump administration is suspending all foreclosures and evictions through the end of April, hoping to provide some immediate relief for homeowners and renters. This move comes as a growing number of Americans face losing jobs and missing their rent and mortgage payments during this pandemic. As the spread of the virus continues to worsen here in the United States, it's also deepening the social and economic division. In Boston, officials have set up a temporary medical clinic outside a homeless shelter to treat people with signs of coronavirus, and more pop-up clinics could soon be established. Joining me now to discuss the impact of the virus on our most vulnerable communities is Dr. Lisa Cooper. She is a professor of medicine at Johns Hopkins University School of Medicine. She is the director of the Johns Hopkins Center for Health Equity. Doctor, thanks again for joining us, and just walk us through who you are focused on. Who are these groups who are most vulnerable during this pandemic?
Thank you. Yes, there are several groups of people who are in vulnerable groups at this time, and they are actually vulnerable people even when there's not a pandemic. And so that includes older persons, it includes very young children, it includes people who have chronic medical and mental health conditions, those with low income and low wage jobs. There are people who are homeless, as you mentioned earlier, people who are institutionalized or imprisoned, and then we have people who have disabilities, physical, mental disabilities, things like hearing and vision impairment. Those are the groups.
Okay, so that's a number of groups. Let's start with children, for instance. We've seen schools shutting down. Meal pickups have been set up for a lot of folks who need that. But of course, that creates some logistical and scheduling difficulties. Sometimes it's not 2 meals, it's just one period of time, kind of during one meal time. What are some of the long-term effects for that group, for children and for low-income Americans who rely on that food?
Right. So, as we know, there are a lot of families that rely upon one individual to work and to provide for those families. And so what happens when school closes is a lot of those children don't have access to the food that they get at school on a regular basis. They also may not have supervision because their parents might be hourly workers and they might be needing to go to work at this time for fear of losing wages or of losing their jobs. So you do have kids who are really not going to get the nutrition they need and are therefore then more likely to be falling susceptible to illness. And we know that lots of these individuals who are in these low-income groups tend to be racial and ethnic minorities, as well as people who are immigrants and people with language and cultural barriers as well.
And one of the new cases of coronavirus that was announced yesterday was a person who was staying at a homeless shelter in New York City. What happens if the virus spreads throughout that community?
There are devastating consequences. We know lots of people who are in that situation. For example, people who are homeless tend to have higher rates of chronic medical conditions, so they're already vulnerable to getting ill, and then they're in crowded conditions, of course. They don't have the type of nutrition that those of us that have higher levels of income and access to those kinds of resources have. And so the likelihood of an infection spreading in that situation is extremely high.
All right, Dr. Lisa Cooper, thank you so much.
Thank you.